Hi, good morning, good afternoon, good evening. Where you are in the world today? This is the world today with Rabbi Dr. Sophia Catherine Woodley von Rothschild, and with me today is Dr. Yogi Hari Kalsha. Dr. Yogi Hari Kalsha is a chiropractor and also uh, ex- experienced in the Eastern traditions of learning and healing. Um, Dr. Yogi Hari Karasha, welcome.
Thanks. I'm glad to be here.
Yes. So, you one thing that many people like to I will always ask is, what is the Eastern methodologies of healing?
Well, there's many Eastern paradigms and descriptions of the human body and physiology, and they tend to look inside for our health and healing and try to accentuate things that are already existing rather than introduce outside things to change those sort of things. And so that's the general philosophy: is that healing comes from within, and whatever we can do to accentuate that and try to be in harmony with nature rather than against it.
Okay. And but in the Eastern concept, do they have anything such as um, herbs or medication of any sort?
Yes, there's quite a few, but it's a little different in application in that it isn't so symptom driven. It's more physiology driven rather than outside. So, for instance, an acupuncturist may find a pulse that's a little bit off, some meridian that's not working correctly in their paradigm, and they may suggest a tea for that, or an ointment, or some other herbal remedy to help along with sometimes their acupuncture.
Okay. And I noticed a lot of times in the Eastern concept, there's the idea of the chakras. Could you kind of illuminate that for us as to how does that work in the what it is and how does and how is it being is used um, to create healing in the Asian system?
Well, all the chakras are is an explanation of physiology that we have already. There are nerve plexuses. There's two in the pelvis. There's one at the navel point, the heart center. The diaphragm is sometimes described as one. The throat, and several in the head, in the third eye and the top of the head.
Okay.
But they're all nerve plexuses, and they all have glands that are related to it. So often health is described as certain chakras not functioning well. And there's many philosophies that are associated with that. For instance, the first chakra is about attachment. The second chakra is about creativity. The third chakra is about power and stability. The fourth chakra is about compassion. The fifth about communication. The sixth is about intuition, and then the totality at the top of the head, the seventh chakra, is about the pineal gland, really, all of its functions and how it affects pretty much everything.
Yeah.
So that's a generality, but it's often used to describe health in different aspects of physiology.
Uh, is it now? You're also a chiropractor, and
Yeah.
how do you use your knowledge of Eastern philosophy and medicine to enhance your chiropractic care?
Well, chiropractic is all about normalizing the nervous system and correcting it when it has a problem. And the nervous system feeds, like I said, all those chakras are those are nervous plexuses, and there can be a problem or interference somewhere along the line. Big time chiropractic is an all upper cervical. There's also musculoskeletal chiropractic, and then there's new age chiropractic, and they all do different things. And that's the challenge with chiropractic, is when you go to a chiropractor, you're not quite sure what they do, what their specialty is. So it's always good to talk to your chiropractor and make sure you're all on the same page as far as what you want as results go. But chiropractic is more of an Eastern philosophy in a way because it's not an outside in thing. It's really from the ideas from above down, inside out, and that is from the brain, all the nervous tissue spreads to the rest of the body, and then that goes from inside out. And we try to restore the nervous system rather than alter it or stimulate it or change it.
Now, in that regard, what are some of the areas where chiropractic care will be most beneficial?
Well, you might say everybody functions better with a in an uninhibited, unobstructed nervous system. And it's good because many modern chiropractors have ways to actually measure the nervous system function, either almost directly through thermography or through downstream ways like dual scales and that sort of thing. Also, we use a lot of imaging to see what's going on relative to the nervous system. So we really, really focus on the nervous system chiropractically.
Okay. Because in one of my other manifestations, I'm a power lifter, and I do a lot of deadlifting and squats. So my spine is always you know tested, to say the least. So
Yeah,
how
I used to
often
do that.
should I go to see a chiropractor to make sure I'm not out of line?
Well, you live in Los Angeles.
No, San Francisco.
No, you live in San Francisco.
Yeah.
Okay, I'm sorry. I was thinking about Franco Colombo, who lives in Los Angeles. But uh, um, that's an interesting topic. First of all, your powerlifting is heavily affected by any interference you have in your upper cervical spine. So having that looked at, and you have a great chiropractors in San Francisco, some experts. Ryan Lawler is downtown, and he is one of the top-notch guys. And he can measure things and also look at them and analyze it, because that affects your powerlifting. The way you stand, the amount of weight you put on each foot, and the way you move your arms, shoulders, and pelvic girdle, etc., are all determined by the way your head sits on your neck. And if that's not sitting right, that little junction up there where those two bones are, the atlas and axis, then you will adapt to that. But when you add a whole bunch of weight to your a small adaptation, you go from maybe a shoe that wears out a little quicker than the other side to somebody getting hurt because your discs are squished on one side rather than the other.
Yeah.
So getting upper cervical care and being really well balanced, and I mean not just well balanced, I mean exquisitely well balanced
Yeah.
before you add 400, 600, 800 pounds is pretty important.
Yeah.
There's many stories I have about injuries from the gym, and we've seen many of them, and they're often caused by small skeletal changes that become really big when you add a lot of weight to them.
Yeah. Yeah, because last week I was in the gym and I did some 400 pound squats, some 350 pound squats, and even as a woman, it's I make sure my feet. I wear a special type of shoes to ensure that my feet firmly planted on the ground, no heels, and that's one thing. So there are many sports doctors now who are chiropractors. Should I focus on seeing them?
Yes, they're good. I would suggest considering that's a very musculoskeletal approach to chiropractic, and I'm sure they do a good job. I would suggest if you're going to put a lot of weight on your spine, to spend some time doing the opposite with inversion. They have great inversion tables that are available for your house, the hang-ups, and there's a whole bunch of other ones that are very accessible. And spending some time doing the opposite of compressing your spine
Right.
is good. And there's a lot of other things to do for your disc health as well. Yoga, moving, core strength, as you know, is super important for those sort of things. And also your psyche, how things that bother you, your stress, all that stuff has a huge effect, especially when you add a lot of weight to it.
That's a very important point, doctor, because one thing I noticed that when I eat certain foods, I get less performance. When I eat certain foods, I get increased performance. So, with that being said, are they as a power lifter, doing mixed martial arts and all that, put a lot of stress on my body? Would you recommend certain form of foods more than others?
That's not my field.
Mm-hmm.
I think nutrition. I think nutrition in general
Mm-hmm.
should be approached in a very analytical way, not experiential. In other words, I tell you what I do. I have a naturopath, and twice a year we do a blood test.
Mm-hmm.
Very, very, very comprehensive blood test. And then I just got my microbiome measured a couple weeks ago.
Mm-hmm.
20-page report, exactly how my gut works and how the chemistry is working, and foods I need to increase and decrease. So I look at the numbers, and then I'm trying to get. I want to optimize those numbers. I want to, get those results the best I can. Both the blood work and the microbiome, and I want to maximize those. What I don't want to do is design my foods around how I feel or even how I perform.
Mm-hmm.
I really want the numbers and the chemistry of it.
Okay.
I'm a fact guy. I don't like trends. Um, I don't like to do things that I'm not going to do for the rest of my life. Those are kind of short term
Mm-hmm.
things. I'd rather do things that are going to be long term, and that especially includes food and how we eat and things we do on a regular basis.
Excellent. Yeah, because uh, I noticed that pivoting back to the Eastern concept, do you foresee a time when hospitals incorporate more Eastern modalities in their approach?
I think many of them have already. There is a yoga program probably in every hospital. I wish the dietitians grasp the importance of food a little better and were a little more venturesome in using foods as medicine, which are very effective. But the amount of fresh and good food in the hospital is pretty slim from what I've seen. I think that there's acupuncturists in Kaiser in Oakland that have been there for 20 years. However, here's the way it works. Hospitals are in the medicine business, and even the acupuncture that they have isn't to help people avoid cancer. It's to help people with the treatments of cancer from the nausea. So they embrace it in a very at distance way. The chiropractors there are not allowed to practice upper cervical chiropractic in general. Most of them are limited to musculoskeletal stuff, and there aren't many chiropractors in hospitals for several reasons. But in general, hospitals are in the drug care business. It's usually end of life care often, and they do what they do really well. I don't begrudge them whatsoever. In fact, I think all of us holistic folks should use medical doctors as much as humanly possible to collect data. What we do about that data is our choice. That's a patient's prerogative and autonomy and license and all that kind of stuff. But it's I think we should use those things as much as possible. I think cats. I think a cone beam CT scan of your neck is very important, and I would hope that someday that's your entry point into healthcare. Is that they do upper cervical X-rays and CTs, etc., and at least make sure that's not a part of your heart disease, digestive problems, hormonal problems, skin disease, all that stuff. it often isn't the main cause, but it's often a component of many imbalances and dysfunctions we have. At least I like to eliminate the conservative stuff first. Do blood tests, urine tests, make sure everything's working correctly. Uh, do some X-rays, see what's happening. I'm always shocked when I look at X-rays. I look at a lot of X-rays. What's how many people have anomalies? Almost everybody has anomalies. Symmetry is almost it's a very rare thing actually. Symmetry, skeletal symmetry. So knowing that stuff is very important. Now treating and taking care of it, that's another topic, and that's a very detailed discussion. But I think we should use them as much as possible. And I don't. I think that Main Street healthcare is going to evolve the next couple of years or next decade due to technology. I think we'll have ways to have haptic sensors that are inside and with you and you can measure things on a regular basis. I've seen heart monitors that are like a watch. All you do is wear a watch and you turn that in and they analyze the details of your heart for a week. That's great technology. It used to take big machines and very cumbersome and it didn't work that well. But I think technology, we're going to have more haptic sensors. I think measuring the microbiome should be an absolute must before we give anybody, especially pharmaceutical drugs, which are very powerful. We should know what their proclivities are, um, microbiome wise, and probably genetically as well.
Yeah, indeed. I one thing. A lot of times when I listen to Eastern philosophy and Eastern concept, as a physicist, I see a lot of similarities with idea of quantum, quantum mechanics, and quantum field theories. Um, between the when sometimes when in the Eastern philosophies.
Often that's used by people who have a lack of evidence to share.
Okay. So in uh, in closing, how would you see? How do you see the Eastern concept going being become more acceptable within the United States and other Western countries?
I think more and more doctors, even medical doctors, are understanding the nuances of Eastern health, and I don't think we should segregate or separate these as much as we do. I work with acupuncturists and medical doctors, and I think they all basically want healthy patients. And I think we're all on the same page to get them there and not make them rely on our care so they can be self-determined in their health.
Excellent. Well, Dr. Yogi Hari Kalsha, thank you so much, and it was a pleasure talking with you, and hope to see you soon again. Bye bye.
Bye bye.
Bye.
Nice to talk to you.
Yes, indeed.
Aloha.
Hello.